Helen, a 72-year-old from Texas, was simply watering her garden when she accidentally tripped over a hose. The fall was so minor she thought she'd only end up with a bruise. But at the hospital, doctors diagnosed her with a hip fracture that required surgery. What's striking is that Helen didn't have heart disease or diabetes. She walked every morning, and she maintained a healthy weight. Her doctor explained, "You didn't break your hip because of a hard fall. You broke it because your bones have been weak on the inside for years." This is the cruel reality of osteoporosis, the silent disease that doesn't cause pain or fever, but slowly makes bones hollow, brittle, and vulnerable to breaking from even the smallest accidents. Millions of people over 60 are living with this ticking time bomb without realizing it. And the most alarming part, once you've had a fracture from osteoporosis, the risk of breaking another bone, along with serious long-term complications, skyrockets. Osteoporosis is not an inevitable part of aging, as many people believe. It's a medical condition in which bone mass and quality deteriorate significantly, making bones brittle, porous, and more prone to fractures. The danger lies in the fact that the disease develops silently over many years, with virtually no obvious warning signs. According to the International Osteoporosis Foundation, 1 in 3 women over the age of 50 will experience an osteoporosis-related fracture in their lifetime. For men, the rate is 1 in 5, lower but still concerning. And once a fracture occurs, especially in the hip or spine, patients can face severe consequences, loss of mobility, overall health decline, and even an increased risk of death within a year after the injury. Sadly, most people only discover they have osteoporosis after their first fracture, when the condition has already progressed. That's why prevention and early detection are the keys to protecting strong, healthy bones well into your 60s and beyond. Common causes of osteoporosis. Osteoporosis isn't just a result of aging. Many silent factors contribute to weakening bones, and the good news is several of them can be controlled if recognized early. Calcium and vitamin D deficiency. Calcium is the building material for bones, while vitamin D helps your body absorb it effectively. A diet lacking in these nutrients over time can cause bone density to drop rapidly. Lack of physical activity. Bones are like muscles. If you don't exercise them regularly, they weaken. Limited walking, skipping workouts, or prolonged sitting can all reduce bone strength. Hormonal imbalances. In women, menopause lowers estrogen, a hormone that protects bone health. In men, low testosterone can also weaken bones. Medications and chronic illnesses. Certain medications like corticosteroids or anti-seizure drugs, and chronic conditions such as rheumatoid arthritis or diabetes can accelerate bone loss. Unhealthy lifestyle habits. Smoking, heavy alcohol consumption, and excessive caffeine intake can all interfere with bone regeneration. Often, these factors overlap, speeding up bone loss without the person even realizing it. Early warning signs of osteoporosis you shouldn't ignore. Osteoporosis is often called the silent thief because it gradually robs bones of their strength without causing obvious symptoms early on. Still, there are subtle warning signs you can watch for. Persistent, unexplained back pain. A dull ache running along the spine or lower back may signal weakened vertebrae or small fractures. Loss of height. Shrinking by 1 to 2 inches, 2 to 3 centimeters without explanation could mean your vertebrae are collapsing. Posture changes. Rounded shoulders, a more curved back, or difficulty standing up straight for long periods. Frequent fractures. A minor trip or fall leading to a broken wrist, hip, or spine, is a red flag. Reduced muscle strength. Feeling unusually weak when lifting objects or climbing stairs, even if it was easy before. Spotting these signs early can help you prevent or slow the progression of osteoporosis before it leads to serious fractures and long-term complications. Early warning signs of osteoporosis you shouldn't ignore. Osteoporosis is often called the silent thief because it quietly steals away bone strength without showing obvious symptoms in the early stages. Still, if you pay close attention, you may notice these early red flags. Persistent, vague back pain. A dull, lingering ache running along the spine or lower back without a clear cause. This could indicate weakening vertebrae or tiny fractures. Loss of height. If you've become about 1 to 2 inches, 2 to 3 centimeters shorter without explanation, it may be due to compressed or collapsed vertebrae. Posture changes. Slight rounding of the shoulders, a more curved back, or difficulty standing upright for extended periods. Fragile bones. A small trip, stumble, or slip that results in a fracture, especially in the wrist, hip, or spine, can be a warning sign. Reduced muscle strength. Feeling weaker when lifting objects or climbing stairs, even if these activities used to be easy. Recognizing these early signs can help you prevent or slow the progression of osteoporosis, rather than only finding out after a serious fracture has already occurred.
Risk factors that increase your chances of developing osteoporosis.
Osteoporosis isn't caused by aging alone. It's influenced by a variety of factors. Understanding them can help you take proactive steps to protect your bones. Age and gender. Women after menopause and men over 65 face a higher risk due to hormone decline, which directly affects bone density. Family history. If your parents or siblings have had fractures related to osteoporosis, your own risk is higher. Calcium and vitamin D deficiency. Diets low in dairy, seafood, leafy greens, or limited sun exposure can gradually weaken bones. Sedentary lifestyle. Sitting for long periods, walking infrequently, or skipping exercise deprives bones of the stimulation they need to stay strong. Unhealthy habits, smoking, heavy alcohol intake, and excessive caffeine consumption can all interfere with calcium absorption. Medical conditions and medications. Chronic illnesses like arthritis or kidney disease, and long-term use of certain medications, such as corticosteroids, can accelerate bone loss. By identifying these risk factors early, you can make lifestyle and dietary adjustments to slow or even prevent the silent progression of osteoporosis. Bone strengthening habits. After age 60, once you reach your 60s, protecting your bones goes beyond just eating well. It's about building a healthy lifestyle you maintain every day. Do weight-bearing exercises. Activities like brisk walking, stair climbing, dancing, or yoga help stimulate the growth of new bone tissue. Get enough calcium and vitamin D. Focus on foods like low-fat dairy, salmon, sardines, leafy greens and eggs, and don't forget about 15 minutes of morning sunlight for natural vitamin D. Maintain good posture. Sit up straight and avoid slouching to reduce strain on your spine. Keep a healthy weight. Being underweight can lower bone density, while excess weight increases stress on the joints. Avoid bone-damaging habits. Limit smoking, alcohol, and high caffeine intake, all of which can weaken bones over time. Practice balance exercises. Standing on one leg or doing Tai Chi can improve stability and reduce your risk of falls, the leading cause of fractures in older adults. By sticking to these habits consistently, You'll help your bones stay stronger, more flexible, and far less vulnerable to osteoporosis.
Early warning signs of osteoporosis you shouldn't ignore.
Osteoporosis often develops silently, without noticeable pain in its early stages. So many people only discover it after a fracture. However, by paying attention, you may notice these early warning signs. Loss of height. If you've become 2-3 centimeters shorter compared to a few years ago, it may indicate that your spinal bones are weakening or collapsing. Stooped or rounded posture. A curved back or shoulders leaning forward can result from weakened and deformed vertebrae. Persistent or sudden back pain, especially in the mid-back or lower back, which may be caused by small, unnoticed spinal fractures. Brittle bones that break easily. Fractures from minor falls or even slight bumps are not normal in healthy bones. Brittle nails and excessive hair loss. These can signal a lack of essential minerals needed for bone health. Recognizing these signs early allows you to get a bone density test and make lifestyle adjustments to prevent the disease from worsening.
How doctors accurately diagnose osteoporosis.
To determine the exact state of your bone health, doctors often rely on specialized tests. The most common is a bone density scan, using the DEXA method. Dull energy X-ray absorptiometry. Considered the gold standard for measuring bone mineral density, but comparing it to that of a healthy person of the same age. The results produce a T-score. A value below -2.5 indicates advanced osteoporosis. In addition, your doctor may order blood tests to check calcium levels, vitamin D, thyroid hormones, and other factors that impact bone health. In some cases, X-rays or MRI scans are needed to detect hidden fractures you may not even be aware of. Regular checkups, especially for postmenopausal women and men over 65, are vital. They not only help detect osteoporosis early, but also track treatment effectiveness and allow timely adjustments to your bone care plan.
Long-term medication use that can lead to osteoporosis.
Certain medications, such as corticosteroids, commonly prescribed for arthritis, asthma, and lupus, or anti-seizure drugs, can reduce bone density when taken over a long period. Many older adults don't realize that the very medications they take daily may be quietly weakening their bones. Solution: talk to your doctor about adding calcium and vitamin D supplements or exploring alternative treatments that have less impact on bone health if long-term medication use is necessary. A 68-year-old patient in California fractured her wrist after a minor fall. The cause was a significant drop in bone density following 5 years of corticosteroid treatment without proper nutritional support.
In older age, balance and reflexes decline.
As we age, our ability to maintain balance and react quickly when tripping decreases significantly. For someone with osteoporosis, even a seemingly harmless fall can lead to a hip fracture, broken wrist, or even spinal fracture. The danger doesn't stop there. After a serious injury, many older adults never fully regain their mobility, which can result in losing independence in daily life. Solution: incorporate gentle exercises like Tai Chi, yoga, or walking to improve muscle strength and balance. Install handrails and non-slip mats at home, and schedule regular eye exams to reduce the risk of falls.
Respiratory decline from weakening rib bones.
Osteoporosis doesn't just affect the bones in your arms, legs, or spine. It can also weaken the ribs and change the shape of your chest cavity. When ribs collapse or become deformed, lung capacity decreases, making breath shallow and preventing you from taking deep, full breaths. This can lead to fatigue, reduced physical stamina, and an overall decline in mobility. Older adults with this condition are more prone to pneumonia, have a harder time recovering from colds or the flu, and may feel short of breath even during light activities. Solution: practice daily deep breathing exercises along with chest expansion stretches. Ensure adequate intake of calcium, vitamin D, and protein to maintain bone health, and seek prompt treatment for signs of a hunched back or chest discomfort.
Chronic pain and sleep disruption from osteoporosis.
Osteoporosis can cause persistent pain, especially at night when the body is at rest, making it difficult to find a comfortable sleeping position. Dull aches in the back, hips, or neck can wake you multiple times during the night, leading to poor quality sleep and morning fatigue. Over time, poor sleep not only slows bone recovery, but also negatively impacts memory, mood, and cardiovascular health. Solution: use pillows and mattresses that support spinal alignment. Avoid lying directly on painful areas, practice gentle stretching before bed, and consult your doctor about safe pain relief options to improve sleep quality. Osteoporosis and emotional well-being. Osteoporosis isn't just a physical condition. As bones weaken and mobility becomes limited, many people start feeling less independent, relying on others for simple daily tasks like grocery shopping, cleaning, or taking a walk outside. This loss of independence can lead to reduced self-confidence, anxiety, and even depression. The fear of falling often keeps people at home more, unintentionally limiting social interaction and weakening personal relationships. Solution: join senior support groups or clubs, maintain safe, low-impact activities, and openly share feelings with family and friends to ease emotional stress and stay socially connected. Osteoporosis. The importance of early detection. Osteoporosis develops silently, which is why many people only discover it after a fracture has occurred. Regular checkups, especially bone density scans, can help detect it early and allow timely intervention before the condition becomes severe. Doctors may also recommend blood tests to check vitamin D, calcium, or hormone levels, all of which directly affect bone health. If you have a family history of osteoporosis or have experienced bone injuries in the past, early screening and consistent monitoring can greatly reduce your risk of complications. Think of regular bone checkups like maintaining a bridge. Spotting weak points early makes repairs far easier than waiting until it collapses. Osteoporosis is not a life sentence for your health. With the right knowledge, healthy habits, and daily care, you can keep your bones strong and resilient year after year. Start today with simple steps. Eat a calcium and vitamin D-rich diet, stay active, avoid harmful habits, and make regular health checkups a priority. Every action you take adds a layer of protection for your body, helping you stay confident, mobile, and safe in your everyday life. If you found this information helpful, hit subscribe and turn on the notification bell to get more tips for complete healthcare. Because strong bones don't just help you live longer, they help you live fully, freely, and happily every day.